1 year post hair transplant. I have slow growth. 1 year back had hair transplant of 2,250 grafts. Hair is grown back after shedding, but they're not growing in length even after 5 months.
Thank you for your question. You've submitted a photo, a limited photo, with the concern that it's been about 1 year since your hair transplant and you're not seeing significant growth. And you stated that there was some shock loss, and so naturally here you are at 1 year and you're concerned about your results. So although I don't know exactly the details of your procedure, although you did describe the number of grafts you had, clearly by the photo you submitted, it does not appear that there is a significant amount of growth happening at this time. So if you haven't had this discussion with your doctor, I'm going to just go over with you a little bit of what are the issues of hair transplantation and how growth can be affected, and a little bit about what we do in our practice that we have applied to try to improve the growth of our hair transplants, as well as helping people who come to us who had hair transplants, whether it was recent or in the past several years prior. So let's begin with just the basic review of what is involved in a hair transplant and what happens. First, a hair transplant is basically the movement of genetically resistant hairs. These are hairs that are in the back of the scalp in a limited space called the donor area that are individually placed in areas where the scalp is losing hair. So little openings are made, and we refer to those as stab incisions. And then those grafts are placed individually. Now the graft is comprised of skin, the hair, the root or the dermal papilla, and some of the tissue that surrounds it. Now when this is performed, there are two things that happen that are related to what we call shock loss. One is the hair grafts themselves temporarily shed, as well as the existing hair in the scalp. Although hair thinning can be to the point where you barely see any hair, with the microscope we are able to often see that the hairs that are in the scalp that is balding or where the hair is thinning, actually there are many miniaturized hairs. Nonetheless, even if there is existing thicker hairs, a lot of those hairs go into shock. So a transition period occurs for several months typically after hair transplant where there's no growth. In the beginning, you're able to see your existing hair and the hair that was transplanted, and you can feel the short little ends of those grafts. And then comes a period where you don't know what's going on and whether or not you're ever going to have some hair growth. As a general rule of thumb, we tell people that at 1 year, most of the grafts will have grown in. Now, from my own experience, I can tell you that there are different factors that will affect the results at 1 year, and one of those factors, it has to do with the rate of hair growth. In our practice, we do a procedure called hair regeneration. And although it's not a transplant, it is a method that we developed to reverse thinning hair. And when we do this treatment, we follow our patients every 3 months. And prior to recent history, we actually had assumed, following a similar pattern as a hair transplant model, that most people would grow within a year. We've changed that. Now we see that a lot of people grow as far out as 18 months. So in a way, we've learned to classify people as fast growers, medium growers, and slow growers. We find that a lot of people who have very advanced hair loss tend to be slow growers. And although we can see some early results and improvement with the hair regeneration treatment, we do see that as far out as 18 months, people have had hair growth. We even have examples of patients who we did the combination of the hair regeneration treatment, which is a combination of extracellular matrix with platelet-rich plasma. Combined that to maximize the survivability and the yield of the hair transplant, as well as to reverse the thinning hair concurrently. We've seen patients where at 12 months they appear to have less hair or didn't even have much growth at all. Then we see them again at 18 months, and then they have robust growth of their thinning hair as well as their hair transplant. Now this is using our method that combines not only the transplant method but also the hair regeneration that we developed. It is not unusual for people to come to us who have had mega sessions and had tremendous numbers of hairs implanted and not have any growth. People have come here from all over the world who have had these mega session procedures, and I'm not saying that they are necessarily the procedures themselves, but factors such as elevated blood pressure and the manipulation of the grafts. You can lose up to 90% of the hair grafts. Now that's not a very encouraging thing to hear when you have a limited donor space and amount of hairs. So hopefully that's not the situation for you. If in your case scenario, we would probably just wait and see how you are doing for another 6 months or so, and then try to determine what the yield actually was. So something that we are doing that has been of tremendous value to a lot of people who have recently had hair transplants or have had hair transplants several years ago and are thinking about a second transplant. As I mentioned earlier, the survivability of grafts is a critical part of the success of a hair transplant. This means that although you may move 2,000, 2,200 hairs, your yield can be 10%, 20%, 30% less than what you've transplanted. In the current popular method of FUE, or follicular unit extraction, there is a very high rate of something called transection, where the hair follicle actually gets cut, and part of that hair, the important part, doesn't manage to grow. So and interestingly, some of those hairs will have enough stem cell activity present that they can grow, but a lot do not. So the yield is critically important. We have been using hair regeneration as a way to help people who have had hair transplants done elsewhere, who've come to us. And examples of patients that we have seen have come to us 1 month after they've had their transplant, had hair regeneration treatment, and as early as 6 to 7 months have had robust growth of both their existing thinning hair and their transplanted hair. So we certainly have seen that hair regeneration has been of value to maximize the healing process and to accelerate the process where the hair grafts actually grow. Again, we still have to go back to the basic nature of the individual and the variations that occur throughout people. And so understanding again that there are slow growers, medium growers, fast growers, you can at least consider that as a factor as to why your hair is not growing. I think that it is very important that you meet with your doctor and discuss the details of your surgery. Have your doctor examine your scalp to evaluate it with the microscope and see what the situation is. Moving on, you are going to have limitations in what your donor area can produce for your next hair transplant if you were to consider it. this is another reason why a lot of people who have had previous hair transplant that was successful but are continuing to thin come and find us, and we do actually hair regeneration injection to thicken their thinning hair. And for many people, they actually avoid a second transplant, and that way they can save the donor area and have that banked for later if they were to ever need it. So I hope you were able to learn something about the process of healing from a hair transplant, as well as the details of hair regeneration, which may be something that you would want to pursue moving forward into the future. So I wish you the best of luck. I hope that was helpful, and thank you for your question.